With Europe facing a massive surge in COVID cases, European Commission chief says the world is in a race against time to understand the new COVID variant. Her comments come as most of Europe is reporting record COVID cases. The new COVID variant has been detected in several EU countries, worsening an already tense situation.
We take this Omicron variant very serious. And we know that we are now in a race against time. Why that? Because we know not all about this variant, but it is a variant of concern. And the scientists and manufacturers need 2 to 3 weeks to have a full picture about the quality of the mutations of this Omicron variant.
The Netherlands, meanwhile, confirmed that it had detected 13 people who tested positive for the Omicron variant. They were among the 61 people who tested positive for COVID after arriving on the last 2 flights from South Africa before a flight ban was imposed. This comes as the country tightened its COVID restrictions, with the country being essentially shut after 5 p.m. Residents of the country say they are resigned to their fate just weeks after violent protests broke out against lockdown restrictions and vaccine mandates.
You never know, right? So the whole pandemic learned us that you don't know upfront. And I try to be not too worried until we know more. So
I think it's going to be happening all the time. It's going to mutate, and we have to be prepared for that. After this variant, new variants will come.
Exactly.
Shifting to France, the country's health minister said that it has detected 8 possible cases of the Omicron variant and that the country will maintain a ban on flights from southern African nations at least till Tuesday. France is in the middle of a 5th wave of the pandemic. It recorded over 31,600 positive cases on Sunday and has seen a spike in patients in the ICU. More than 75% of France's population is fully vaccinated and nearly 7 million people have had a booster shot.
Dès qu'il y a un cas suspect, nous isolons la personne et nous procédons à des tests poussés, c'est-à-dire un séquençage. Nous regardons le profil génétique du variant et du virus. À date, il n'y a pas encore eu d'identification de ce type de variant Omicron sur le territoire national, mais c'est une question d'heures, très probablement, il faut se dire les choses. Il circule déjà en Belgique, il a été identifié en Italie, il a été identifié en Allemagne. Je voyais qu'il a été identifié également en Australie.
In Germany, calls for tighter restrictions are rising as fears about the new variant rose. 2 Omicron cases have been detected in the country so far. Restrictions on air travel from South Africa also took effect on Sunday, meaning that airlines can fly only Germans to Germany from South Africa, and even those who are vaccinated must spend 14 days in quarantine. Germany is currently struggling to contain a 4th wave of the coronavirus pandemic. It reported over 44,000 new cases on Sunday, and over 100,000 people have died due to COVID since the start of the pandemic. In Austria, over 5,000 people took to the streets on the weekend to protest against the compulsory coronavirus vaccinations. Austria has one of the lowest vaccination rates in Western Europe. Only about 66% of its 8.9 million population have gotten jabbed. Austria has a very vocal minority who refuse to be inoculated. The protests come after Austria pledged to be the first European country to mandate vaccines beginning February 1st. Meanwhile, across the English Channel, Britain said it will convene an urgent meeting of G7 health ministers today to discuss developments on the new Omicron coronavirus variant. The British government announced new measures over the weekend to try to slow the spread of the new COVID-19 variant, toughening rules for people arriving in Britain and ordering mandatory use of masks in public. Some school children will also be required to wear face coverings in communal areas. Well, our correspondent Oli Barat is joining us live from London for more updates on this. Oli, good to see you and thank you very much for joining us at this hour. A lot of disappointment, especially from the African continent, following the restrictions imposed after the discovery of Omicron. We have organizations like the AU, or the African Union, and the WHO condemning and even acknowledging that the decisions taken by some European nations was rushed. What needs to be, or what needs to happen now, given the severity of this situation?
What needs to happen now in what sense? Do you mean what the UK government is going to do next? If that is what your question means, the UK believes that the situation is one of trying to gather as much information as possible now. It imposed the restrictions on that southern African region, the UK government says, to buy time. It doesn't expect that that will stop Omicron coming to the United Kingdom or spreading in the United Kingdom. Indeed, there are a number of confirmed cases here already. But it does believe that since there is a significant outbreak that we have confirmed in that southern African region, that shutting down travel from that part of the world will mean that Omicron, the new variant, will seed less quickly here in the United Kingdom and can therefore buy some time. But that is leading to strong criticism from African countries, from international organisations, some of them as well, which believe that this is the wrong way to go about things. It is also going to lead to further questions as we see Omicron confirmed in further European countries. That is going to lead countries like South Africa to say, why have we been shut down for international travel? Why has Belgium not been? Why has France not been? Why has Italy not been? If, as I say, we start to see more confirmed cases on the European continent. But the UK government for now believes that it is taking a precautionary approach to try and buy itself some time with that restriction on international travel from some parts of the world and with those extra measures here in the UK.
Only there's another issue. Vaccine inequity, or what some would call vaccine apartheid, is a sticking point. WHO has pointed out the matter even today, that the longer the issue persists, the longer the virus survives. Which countries need to act, or what do you think, which countries need to act now, and what are they obliged to do to fight this imbalance?
Well, that's clearly going to be one of the topics for the G7 ministers to discuss today. The UK position on this, and Boris Johnson was asked about this at the weekend, is that the UK's role so far has been about making sure that the AstraZeneca jab was available at cost to millions and millions of people around the world. It also says that it believes that some of the problems in developing nations with vaccination rates at the moment has actually been around hesitancy and take-up, not just as simply as saying that the doses haven't got to those countries in large enough numbers.
Oli Barat, thank you very much for your insights and for talking to us today. WION is now available in your country. Download the app now and get all the news on the move.